Hey, Pusino Pusinet, new little video. On this one, why are we looking at books on the door? I said earlier I would do a set of videos on medications and concepts. And this one's going to be on antibiotics and some products that a lot of people use on wound care. It won't be on wound care per se because we're going to do another video on that subject a little bit later. I'm finishing to read this to give a few ideas and things like that, and so I'm waiting a little bit more and have a few experience, but it's going to be very interesting. I'm learning a lot of stuff and having a lot of new ideas, so it's going to be interesting to talk. But the reason I'm doing this is that I'm trying to, a lot of people are kind of misunderstanding some stuff, especially when it comes to wounds. And I want to use this image right now that we're going to see to demonstrate the reasoning that we do. So basically what I'm showing here, and I thought like a few ways, and I think that would be an easy way to show. So imagine that those books are microbes and the door is our skin. So right now, and I was reading an article lately, I think they identify that we have about 8,000, so 8 with 30 after, of different bacteria that lives on us at all time. So 8,000, so we're dirty people. No matter how much you clean with soaps and everything, we have about 8,000 little things living on their skin. And they don't quite know, some are good, some are bad, some are... So as we have our skin protecting us, everything is good, everything is tiki-do like we say in Quebec. But the issue that happens is that when you have a wound, what happened is this. So as you saw, the skin break down, so the door opens, and some of those microbes goes. As you can see, some will go deep, some won't go. All of them are different microbes. Some are what we call anaerobic, some are aerobic. So anaerobic means that they thrive, they do not do well when there's oxygen on it. And some of them are aerobic, meaning that they try with oxygen, they do very well. So one of the things that a lot of people will do is put products on those. And one of the reason that, and this will be discussed a little bit later again in videos on wound care, is why I don't recommend closure in a dirty environment, is that those things, if you do suture, this is what have happened. So basically now your microbes on this side, and you just have closed because you did initial closure, which is suture, and your books are here. Well, then the issue would be, oh well, just let's clean those things and put some products. And this is what we're going to talk about in the next section. So based on what I just showed you, a lot of people worry about bacteria going into the skin, and they'll use product like hydroxyl peroxide, alcohol, proviodine, and things like that. And the concept to understand here is that your wound, so we'll talk about the wounds in the first place, and then we'll talk, as we advance, we'll talk a little bit more about antibiotics. So this one will be like a two-part kind of thing. So your wound will get dirty. This is for sure. I saw, as soon as the skin breaks down, no matter how clean you are, even if you just came out of the shower and everything, there's still some bacteria that you have on you. And it will go into the wound. Obviously, cleaner you are, less invasions you'll have. But there will still be some. So a lot of people, they use those kind of products. everything that you always try to do in medicine is to weight risk and benefits. And so, for example, and again, I'll go in the extreme just to make a point, but if you truly would want to clean the wounds, well, fire would be the best treatment. So if you cut your hand, you could put it in fire, it basically would kill everything. But obviously the risk benefits of it is that I would have a burned hand, and the benefits of it, sure, I would kill pretty much everything, but no, I would lose my hands, or I could chop it and stuff. So obviously, as you can see in the extremes, the benefits of it versus the risks are way out the benefits of the wounds. So there's a lot of treatment out there. So a lot of people use like Polysporin, those products. The problem with those products, they do have benefits, but they have a lot of risk as well. The betadine, alcohol, and peroxide, usually are those three that you can use. Do we never use it in the wound care? No. But when we use them, they are used by healthcare professional, well trained, and in very, very specific conditions. And we're talking more about chronic wounds, and then you got healing, non-healing, and the plans and everything, which is way past what we're talking about in those YouTube videos. So I wouldn't recommend to have any of those things to use, even propiodine. I do carry some of it, but again, it's to use some of it. And then just coming out of the conference, we had a talk on wound care. And as the book I was showing, what I was reading, one of the best treatment, and again, I did a video in the past, and I'll put a link down on talking about colonization of wounds and stuff like this. One thing that really, and the most important thing that you can do in these wounds is flush those bacteria. And how you can do that, and again, you won't clean it all, but by flushing the bacteria is you're using just irrigation. So if you can drink it, you can flush it. So it doesn't even have to be sterile water, it doesn't have to be anything, you can just flush it. So why not use the other products? They do have benefits, like if you put alcohol on it. I mean, before we start an IV, we do clean the skin. We use propiodine on intake, we use other chlorhexidine on skin as well. So when they go to the OR, don't they clean the skin? Yes, they do. And the reason why they do that, first of all, they're more in a sterile environment or cleaner environment. So for example, if you talk about the OR, I mean, they're all wearing, also OR is for operation room, they're all wearing, like, you know, those sterile gowns and those gloves, and the whole environment's been clean and filter and everything. So what they're trying to do is decrease the number of books, in my examples, decrease the number of books that when they're going to cut the skin will go in, and even not decrease it as to eliminate it. So they'll try to kill it before it goes in. So that's why they use those products, but it's on intake skin. When the door is closed, there's no much chance. And so it's not as toxic for the inside of the wounds. So the risk benefits, the benefits outweigh the risk, because there's not a lot of risk for having bad skin. There's a lot of benefits to it, because now you decrease your chance of having complications like infections and things like that. And obviously, they're going deeper, especially for surgery. I mean, they're opening up, they're going inside and stuff. And so if you have like a lot of wounds in there and you have to close it at one point, where you're talking about a party for bacteria. So that's why they clean the skin before. But this is a prevention. So it doesn't really apply to a situation, because when you're going to deal with a wound, the skin is already open. The door is already open. The stuff that was on the other side of the door is in the wound. So now we're talking about a different situation. So now, why wouldn't we use those products? I mean, they're proven that, you know, when you do surgery or something like this, I mean, you clean the skin and everything's good. But it's, again, this ratio of risk benefits. And the reason is that what happened is that those products are what we call cytotoxic. And what they mean is that the cells that are so they kill bacteria, yes, but also they'll do damage to the cells that are on the other side, because the tissue that we have obviously inside our skin is way more fragile than our skin itself. And so what they'll do is they'll do damage to this, and they can increase the inflammatory process. And increasing the inflammatory process can create more damage to your wound, and your wounds can get worse. So that's why, for example, if you have to deal with wounds, the risk benefits of irrigation outweigh the benefits outweigh, because they're going to clean the wounds and stuff, and we're talking just about 1 liter, and again we'll do it more in the wound care. The risk of just leaving some of the wounds inside, it's much better to irrigate than not irrigate. But to use other product is totally the opposite, because there's more risk for the wounds than the benefit's going to do to try to kill everything that you won't achieve, by the way, but that you try to kill as much as you can on the wounds will create more damage to your wound than anything else. So that's why we're switched to just irrigation and anything like that. And so that's why we don't use those products in the wound itself. So now, let's say for whatever reason you were not able to clean all this stuff and everything, and got more dirty than what we talked and everything, and now you can get an infection. So it brings us to a second point, which is the use of antibiotics. A lot of people that are preparing and for self-reliance medicine, things like that, talks about the use of antibiotics. There's one thing to understand about antibiotics. They're not all made equally. Meaning that some condition will respond very well to antibiotics that you take per amount, but some won't. So for example, in wounds again, you can have an infection that is not in your bloodstream, and in between the outside of the skin and the inside of the skin. So we have I've exaggerated, I mean it's at microscopic level, but you have like these levels about this, and the infection will be kind of around here. And so what happened is that some antibiotics will do well to get to the wound, passing through tissue, adipose tissue, so like fats and stuff like this, but some won't. So then you need intravenous antibiotics. Is it thinkable? Can we imagine having IV antibiotics in a prepper kit? Not really. I don't think it is a feasible thing. So for some of those conditions, even if you take as much antibiotic per amount that you can, they can fail. So that's the first thing you want to do. The second thing about antibiotics is you have to choose the right antibiotic for the right thing. In what I was talking in the intro kind of video, I was talking about anaerobic and aerobic bacteria. First of all, antibiotics only works for bacteria. Again, antibiotics only works for bacteria. And we got a whole bunch of things. You got virus, you got worms, you got a whole kind of different organism that can be either infected yourself inside. So we'll leave the wounds a little bit and we'll go more general. So for example, you can have a parasite that can live in your stomach, and that's why you have diarrhea and things like that. You can have a whole bunch of things that can live. Antibiotics won't help with those. Some condition will, some won't.